Hi, my name is Dr. Omar Ibrahim, and I'm a board certified dermatologist at Chicago Cosmetic Surgery and Dermatology. Today, I wanted to talk about cellulite and the latest advances in its treatment. Now, in prior videos and prior posts, we've talked about radio frequency, we've talked about injectables, we've talked about rapid acoustic pulse waves in the treatment of cellulite. But today, I'm super excited to announce the latest player in the game, and that is Aveli. So what is cellulite? So cellulite is a rippling and dimpling of the skin, usually on the buttocks and the thighs, and it can affect up to 80% of women at least. So what causes it? So there are several different causes of cellulite. This includes skin laxity, so looseness of the skin, fat tissue, but the main cause that we know leads to cellulite are these fibrous bands that pull down on the skin. So basically what happens is this is the skin's level, and there are bands that pull the skin down and attach the skin to the muscle. Now, over time, the bands can actually get shorter and can get thicker, and the fat around the bands can cause this bulging. And so that's why you get these what patients say, these ripples, dimples, and the cottage cheese sort of appearance to the skin. So how do we treat cellulite? So the treatment of cellulite is multifactorial. You can treat the skin, you can treat the fat, and you can treat the bands. So you want to ask, is there excess skin laxity? Is there excess fat tissue in the area? And you also, of course, want to look at the fibrous bands themselves that cause and pull down on the cellulite. You can use devices. So we've talked before about radio frequency. We've talked about ultrasound. There are other lasers that can treat cellulite as well. But really the gold standard treatment is subcision. So subcision involves the physical cutting of those bands that we talked about that actually are one of the major causes of cellulite. So today I wanted to talk to you about a brand new procedure in the treatment of cellulite that's called Aveli. So Aveli involves the subcision of these fibrous bands that tether down and cause cellulite. For me, it's going to be my go-to treatment, at least initially, in the treatment of cellulite. So as I mentioned, the treatment involves the subcision of these fibrous bands. So the physical cutting of these bands. It's a one-time in-office procedure. So how does the procedure work when you're on the table in the procedure room? The area is marked out. Local anesthesia or local lidocaine is applied to the area, so the area is completely numb. And then we go in with a small tool just about this size, right underneath the layer of the skin, painlessly. You don't feel a thing. It has a tiny little hook at the end of it that actually latches on to the septa that are pulling the skin down. And we use that tiny little hook to release that septa. Once that septa is released, we go back into the same exact area and we pull. And if the dimple actually pulls down, we release the septa again. Because as we've come to learn from this procedure, the septa can actually be very strong and can pull down significantly. And there could be multiple septa and multiple bands pulling down on the skin, causing a single dimple. And so each of those specific bands need to be released one by one. So it's a very meticulous procedure that requires attention to detail, but that's why it yields excellent results. So what makes this treatment different? So the difference between this and other subcision devices you might have heard of is that there's real-time verification. So what does this mean? It means that when we're in the procedure room and we cut those bands, I go back and I verify that those bands have been cut. And if they have not been released, then we go back and we release them again. And we do not move on from a single dimple until we're sure it has been completely subcised and released. And so when you get off that table, we know in real time that every single dimple that we marked out and treated has been treated. This crucial step is what guarantees Aveli's results. So how does the procedure feel and how do you feel afterwards? So during the actual procedures in the study, the average pain level on a scale of 1 to 10 was about a 1 out of 10 or a 1.1 out of 10. So basically painless. After the treatment, you might feel a little bit tenderness to pressure, a little bit of tenderness to touch, nothing that Tylenol will not take care of. I tell patients after the procedure that you will bruise. It's a fact. It happened in most of the patients in the studies, but the good news is the bruising can be mild, moderate to severe. Most patients were mild to moderate, and the bruising can last anywhere between 1 to up to 3 to 4 weeks. And once the bruising resolves, most of the time, there's nothing left over on the skin. Most patients and most study subjects actually went back to activities of normal daily living within 48 hours after the procedure. No time off really is required. We just asked for light exercise within the first few days, and then you can go back to your normal exercise routine within 3 to 4 days. So where does Aveli come into play in the grand scheme of things when it comes to treating cellulite? For me personally, if a patient is an Aveli candidate, I would start with Aveli, as this will do most of the groundwork when it comes to treating those deeper dimples and ripples that cause most of the cellulite on the patient. That doesn't mean that the other devices and treatments out there don't have a place. They absolutely do. We can use radio frequency to tighten the skin. We can also use fat reduction modalities to actually melt and dissolve the fat in localized areas if we need to. So all in all, as you can tell, cellulite is a global multifactorial treatment that requires multiple modalities to get the best results. Now, this video is not sponsored by Aveli or its parent company, Revel, but it's a procedure that I'm super excited about. I was one of the first individuals to actually perform the procedure in the US and will be one of the only centers in the entirety of the Midwest to offer Aveli. So stay tuned, subscribe to our channel, follow us on social media for the latest updates on Aveli, the latest news, and of course, excellent before and after photos.